Time for News Extra, brought to you today by Gering Civic Center. Here's Kevin Mooney.
Thank you, Dennis. Good morning, everyone. Our guests today are Dr. Raqeeb Haque. He is the new neurosurgeon up at Regional West Medical Center. We also have Dr. Omar Jiminez here. And part of the reason why Dr. Haque is in here is he's going to give Dr. Jiminez a little relief here because he's been a very busy guy as a neurosurgeon up at Regional West Medical Center. So, Dr. Haque, welcome, first of all.
Thank you very much.
All right. So, you've been in town how long now?
It's been about a month and a half.
About a month and a half, 2 months. How do you like it so far?
You know, I love it. People have been very, very grateful and very nice. It's a pleasure working with the people at the Regional West Medical Center. And obviously, I'm very excited to be joining Dr. Jiminez's practice. So, very excited to be here.
Yeah. All right. So, let's go over these are amazing, where you've been and your qualifications are incredible.
Oh, thank you.
So
thank you very much.
Tell us about those.
Well, you know, I grew up in Maryland. I went to college at Harvard University. I went to a medical school, the same place Dr. Jiminez did his fellowship at Johns Hopkins University, Johns Hopkins Medical College. I went to Columbia for my residency, and I did my fellowship at Northwestern.
Wow. So you've been about at every major super university there is in this country.
A lot of traveling, but it's nice.
Just need to go to Stanford and you'd have the whole deal, I think.
Well, the weather might be a little different, but yeah.
All right. So what type of things are you going to do? We mentioned you're going to help Dr. Jiminez here with a lot of work that he does here, but you're going to help him out, and you guys have some other things planned as well, right?
We do. You know, it's Dr. Jiminez has built a tremendous practice here. We focus on minimally invasive surgery and minimally invasive spinal techniques. Techniques that Dr. Jiminez has really evolved quite a bit in the last 6 to 7 years. So our goal is to provide minimally invasive approaches for spinal and cranial conditions where it minimizes blood loss, minimizes the risk of infections, and allows patients to go home hopefully in a safer and a better manner in an earlier amount of time.
All right. You were fairly busy over the last week, right? We had a number of car accidents. All of a sudden, you were pretty busy last week, right?
It was actually very nice to see. You know, I don't have a lot of training and a lot of trauma, so to be able to come to a place and see all this trauma and work with Dr. Jiminez, it's pretty amazing to be needed in a community that sees such a breadth of neurosurgery. Things that I think I've said before, I've only read in books. I've seen in the last 2 months that are things I've only read in books. So the breadth of neurosurgery is very impressive here.
All right. Very good. We're going to take a break. We're going to talk to Dr. Jiminez about kind of a new program they have to help out patients right after this.
Why trust a newbie with your special day? The Gering Civic Center, with 21 years of wedding experience, combined with the Meat Shop's 31 years of cooking experience, have earned your respect, with excellent service and delicious food. With a professional staff to assist in planning your special day, call Western Nebraska's premier multifunction facility at 436-6888 or visit us at GeringCivicCenter.com or like us on Facebook.
Back on News Extra, and we're talking about neurosurgery this morning over at Regional West Medical Center. We just talked to Dr. Raqeeb Haque, who is the new neurosurgeon up at Regional West Medical Center. He's helping out Dr. Omar Jiminez with his practice that he's had here for about 7 years, isn't it? Something like that?
More like 7.5 years.
7.5 years?
It's been a while.
Yeah, it's been a while. And so we learned from Dr. Haque all his credentials and the fact that he kind of learned a little bit about trauma this week, ran him through that, kind of showed him the ropes, and he did pretty well, didn't he?
Oh, he certainly did. I mean, he's very modest, so he says that he hasn't seen these things, but he certainly has been training them and has done many of these operations previously.
Okay. So you guys, you were talking outside about this new program, this comprehensive spine center is what you want to basically introduce here in Scottsbluff. Tell us what that would entail with your practice.
So basically, it's a concept that's sort of taken, how do you say, in the mainstream as the way medicine's going, where we treat patients as a whole. Not only do we deal with their sort of chronic pain issues, but also put them through a process of rehabilitation. And we work with other physicians and specialties to try to bring them along in the course of treatment. And eventually, if conservative care does not work, then we consider surgery as a last option. In the comprehensive center that we are in the process of developing, we have physiatrists, which are physical rehabilitation physicians. We have rehabilitation specialists that also help giving physical therapy. We have pain specialists as well. We work with psychiatrists, for example, to deal with some of the addiction problems that patients may have with chronic pain medications. In addition to the fact that some of these patients have very complex social issues as well. So we're trying to treat the patient as a whole. And for example, there are cases where we'll determine the patient has a hip problem or a shoulder problem. We have easy access to the orthopedic doctors because they're part of our team to be able to manage these patients appropriately.
Okay. All right. And you're also kind of doing a kind of a bring you back program. In other words, if somebody does surgery, they get a chance to talk to everybody involved in their care prior to the surgery, right?
Yeah. I mean, as you know, surgery is a pretty daunting experience. You've had surgery before, and it's a foreign sort of concept, not only the procedure, but also the language itself, the terminology. So in order for us to educate our patients, we've developed this program called Bring You Back program, where patients come back typically a week before surgery. They get to meet a lot of the staff involved in their care, in their future care, and they have an opportunity to ask more questions. They see the facility where they're going to have surgery. They see the nursing floors. They are able to ask questions regarding what they're going to have, expectations before and after surgery.
Okay, very good. All right, we're running out of time, but good luck with the new program.
Thank you very much.
And Dr. Haque, good to see you. Good luck.
Thank you very much.
Glad to have you here.
Sure.
All right, back to Denny. We appreciate Dr. Haque and Dr. Jiminez being here this morning.